Hello everyone, I am Judaline Tila Bastida and I am the second presenter. I am going to continue the last discussion of Miss Alvi about tuberculosis. So again, what is tuberculosis? So tuberculosis or TB, it is a serious illness that mainly affect the lungs. The main germs that can cause tuberculosis are a type of bacteria. Now let's proceed in the treatment for tuberculosis. So the first effective antibiotic or for TB treatment was streptomycin, which was introduced in 1944. So what is streptomycin? So streptomycin, an antibiotic that was drug first drug to be successful against tuberculosis. Even the short course of tubercle treatment for TB, there are the various in the regimen depending on the sensitivity or the organism of other factor. Requires the patient to adhere the minimum of 6-month therapy. So multiple drug therapy is needed to minimize the emergence of resistance. So there are two lines of drugs, so first and the second. So in addition, the first line drugs, there are the number of line drugs. So that it can be used or that can be used mainly if resistance develop to alternatives. So these drugs are either less effective than first line drugs and have a toxic side effects, or maybe unavailable in other country.
Today's topic is tuberculosis, or TB, an infectious disease that may affect almost any tissue of the body, especially the lungs, caused by the organism Mycobacterium tuberculosis. About 10 million people worldwide were sick with TB in 2015, and about 1.8 million people died from TB worldwide in 2015, according to the World Health Organization. What are the causes of tuberculosis? All cases of TB are passed from person to person via droplets. When someone with TB infection coughs, sneezes, or talks, tiny droplets of saliva or mucus are expelled into the air, which can be inhaled by another person. Once infectious particles reach the alveoli, the small sac-like structures in the air spaces in the lungs, another cell called the macrophage engulfs the TB bacteria. Then the bacteria are transmitted to the lymphatic system and bloodstream, and spread to other organs occurs. The bacteria further multiply in organs that have high oxygen pressures, such as the upper lobes of the lungs, the kidneys, bone marrow, and meninges, the membrane-like coverings of the brain and spinal cord. Latent TB. You have the germs in your body, but your immune system stops them from spreading. That means you don't have any symptoms and you're not contagious. But the infection is still alive in your body and can one day become active. Signs and symptoms. A cough that lasts more than 3 weeks. Chest pain. Coughing up blood. Feeling tired all the time. Night sweats. Chills. Fever. Loss of appetite. Weight loss. Diagnosis. During the physical exam, your doctor will check your lymph nodes for swelling and use a stethoscope to listen carefully to the sounds your lungs make while you breathe. Blood tests. Blood tests may be used to confirm or rule out latent or active tuberculosis. These tests are sophisticated technology to measure your immune system's reaction to TB bacteria. Imaging tests. If you've had a positive skin test, your doctor is likely to order a chest X-ray or a CT scan. This may show white spots in your lungs where your immune system has walled off TB bacteria, or it may reveal changes in your lungs caused by active tuberculosis. Sputum tests. If your chest X-ray shows signs of tuberculosis, your doctor may take samples of your sputum, the mucus that comes up when you cough. The samples are tested for TB bacteria. Treatment. With the proper treatment, tuberculosis is almost always curable. Doctors prescribe antibiotics to kill the bacteria that cause it. You'll need to take them for 6 to 9 months. What medications you take and how long you'll have to take them depends on which works to eradicate your TB. Sometimes antibiotics used to treat the disease don't work. Doctors call this drug-resistant TB. If you have this form of the disease, you may need to take stronger medications for longer. The main drugs for tuberculosis are ethambutol, isoniazid, pyrazinamide, rifampin. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
So now, let's proceed in the testing drug for susceptibility. So, the current culture-based method for drug susceptibility testing, which consider the so-called gold standard. So, drug susceptibility testing, it is a difficult procedure to standardize and proficiency in performing these tests. So, it requires understanding for many or any elements. So, it can take long as 4 to 8 weeks for finalized results. Certain newly developed assay take advantage of the fact that the pathogens grow faster in liquid media. So these assays are simultaneously useful for both diagnosis and determination of drug susceptibility. So worldwide incidence of tuberculosis. So tuberculosis has emerged as a global pandemic. So estimated that 9 million people develop active TB every year. So that infection result more than 2 million deaths annually. So worldwide, the incidence of TB per capita is falling at 1%. However, the world population is growing about 2% a year. So therefore, so the total number of TB cases is still rising. So I have there a short video clip.
The emergence of antibiotic-resistant tuberculosis has led to increased morbidity, mortality, and disease transmission. These TB strains include multi-drug-resistant tuberculosis, or MDR-TB, resistant to first-line drugs isoniazid and rifampin, and extensively drug-resistant tuberculosis, or XDR-TB, resistant to isoniazid and rifampin plus fluoroquinolones and second-line injectable drugs. Globally, there is a need to ensure universal and prompt testing for patients with TB to determine the most effective antibiotics and the duration of treatment needed. This clinical study assessed the diagnostic accuracy of an investigational automated cartridge-based laboratory test for the rapid analysis of sputum from patients with TB to detect gene mutations associated with antibiotic resistance. The investigational assay was used to test sputum samples from 308 patients with culture-positive TB in China and South Korea for resistance to isoniazid, fluoroquinolones, ofloxacin and moxifloxacin, and aminoglycosides, kanamycin and amikacin. The assay's sensitivity and specificity were determined relative to gold standard phenotypic culture drug susceptibility testing and DNA sequencing. The investigational assay accurately detected TB strains with DNA mutations associated with resistance to isoniazid, fluoroquinolones, kanamycin, and amikacin. Among patients with MDR-TB, the investigational assay correctly identified 90.6% of those without phenotypic resistance to fluoroquinolones or aminoglycosides, patients who may be eligible to receive a shorter course of treatment for MDR-TB. The investigational assay correctly identified 88% of MDR-TB patients with resistance to fluoroquinolones, aminoglycosides, or both, patients who would not be eligible to receive a shorter course of treatment. The authors conclude that the investigational assay identified most TB strains resistant to isoniazid, fluoroquinolones, and aminoglycosides. This new rapid assay, yielding results in just over 2 hours, holds promise globally as a point-of-care test to guide more effective diagnosis and treatment of patients with antibiotic-resistant tuberculosis. Full study results are available at nejm.org.
Now, let's proceed in the bacterial pneumonia. So the term pneumonia is applied to many pulmonary infections, most of which caused by bacteria. So, bacterial pneumonia it is caused by streptococcus. Pneumonia is the most common, about two-thirds of cases, and referred to typical pneumonia. So, pneumonia caused by microorganisms, which include the fungi, protozoa, viruses, and other bacteria. So, pneumonia caused by other microorganisms.
Hey students, welcome to Scotia.com. Let's talk about bacterial pneumonia. Pneumonia is the inflammation of one or both the lungs. It is caused by various organisms like bacteria, viruses and even fungi like Aspergillus. Bacterial pneumonia can be caused by S. pneumonia, H. influenzae or M. catarrhalis. These gain entry into the host and reach the lungs, ultimately infecting the alveoli. Inside the alveoli, S. pneumonia uses PSPA to attach to PAF on type 2 pneumocytes. They secrete a cytotoxin pneumolysin, which binds to cholesterol in plasma membrane, causing cell lysis. It also helps in bacterial multiplication, and promotes bacterial penetration into the bloodstream. This process triggers an inflammatory response, in which dust cells use TLRs to recognize PAMPs on bacterial surface, thus causing synthesis of cytokines like TNF-alpha etc., causing endothelial cell retraction, making the capillaries leaky. This also increases gaps between type 1 pneumocytes. This causes proteins entry into alveoli, which in turn draws water inside the alveoli, causing edema. This leads to the accumulation of exudates containing WBCs in alveoli. The full resolution of the condition may cause lung abscess, which is described as necrotic liquefaction. If your books are giving you hard times, join us on Scotia.com.
So, next we have a different types of pneumonia. So we have the first we have the pneumococcal pneumonia. Pneumococcal pneumonia caused by S. pneumonia, a gram-positive ovoid bacterium. It is a type of bacterial pneumonia that is caused by Streptococcus pneumonia. It is the most common bacterial pneumonia found in adults. So the most common type of community-acquired pneumonia and one of the most common type of pneumococcal infections. So there have some symptoms that include difficulty breathing, chest pain, high fever, shaking chills, excessive sweating, and fatigue.
Pneumonia is an infection of the lungs that may be caused by bacteria, viruses, or fungi. There are many different types of pneumonia. The most common type of bacterial pneumonia is called pneumococcal pneumonia. You can get pneumococcal pneumonia through coughing or close contact with an infected individual. Many people think it's the flu or a cold, but it's not. It is caused by bacteria. Common symptoms include high fever, shortness of breath, chest pain, and more. Some symptoms can appear suddenly and may last for weeks or longer. In severe cases, it can lead to hospitalization or even death. The infection can cause the lungs to become inflamed and fill up with mucus. That can make it hard to breathe. Even if you are healthy, you are at increased risk for pneumococcal pneumonia if you are 65 or older, because as you age, your immune system naturally weakens, making it harder to fight off infections. If you are living with a chronic lung disease or other condition, you may be at increased risk for pneumococcal pneumonia. Vaccination can help protect you from getting sick with pneumococcal pneumonia. People 65 or older, and especially those at risk due to certain health conditions, should talk to their doctor or pharmacist about getting vaccinated against pneumococcal pneumonia. Get all the facts at lung.org.
Now let's proceed in the diagnosis and the treatment. So diagnosis. Doctor can use urine to test and to help make diagnosis of pneumococcal pneumonia in adults. Doctor usually diagnose the ear, and sinus infections based on a history and a physical exam finding that support pneumococcal infections. If the doctor suspects serious pneumococcal disease like meningitis or bloodstream infections, they will collect samples of cerebrospinal fluid or blood. It can be found in surrounds our brain and spinal cord. Now let's proceed in the Haemophilus influenza pneumonia. So Haemophilus influenza is a gram-negative Cucubacillus and a gram strain of septum will differentiate this type of pneumonia from pneumococcal pneumonia. It is infections spread through sneezing, coughing, or touching. The bacteria can cause the middle ear infections and more infections including meningitis. So there have some symptoms we have are the risk of getting or the high risk of getting a Haemophilus influenza. So they have the children, particularly boys, black people, Native Americans, people who attend work or work at the daycare center, or people who live in a crowded condition.
Haemophilus influenzae. Haemophilus influenzae. A gram-negative, Cucubacillary, facultatively anaerobic pathogenic bacterium that grows in the upper airways of adults and children, normally without causing any disease. The bacterium was mistakenly considered to be the cause of influenza until 1933 and is still colloquially known as bacterial influenza. Types: encapsulated strains A, B, C, D, E, and F. The capsule allows them to resist phagocytosis and complement-mediated lysis. Unencapsulated strains, non-typable, NTHI, lack capsular serotypes. Classified by multilocus sequence typing. Genetic diversity is greater. Less invasive. However, produce an inflammatory response leading to many symptoms. Diagnosis. Symptoms 1. Upper respiratory tract infection mimicking a viral infection, usually associated with fevers, often low grade. 2. Lower respiratory tract infection in a few days, mimicking wheezy bronchitis. Sputum, often gray or creamy in color, may be difficult to expectorate. The cough may persist for weeks without appropriate treatment. Not respond to penicillins are first-generation cephalosporins. A chest X-ray can identify alveolar consolidation. Bacterial culture or latex particle agglutinations, not from the nasopharyngeal cavity or sputum, because these sites are colonized in disease-free individuals from cerebrospinal fluid or blood.
Now let's proceed in the diagnosis. So to diagnose the infections, the doctor can take some example of blood or other body fluids. So if the doctor gets the sample, they send it to laboratory and let grow or culture the bacteria to see what is the proper or which antibiotics are effective for this disease. So we have there a treatment. So Haemophilus influenza infections are treated with antibiotics, which can use depends on severity and location of infections. So if the children have a serious infections, they have hospitalized and keep in an isolation to prevent other people being exposed or being affected through the droplets of the air or the droplets or in the air, which can called a respiratory isolation for 24 hours after the antibiotic started. So now let's proceed in the prevention. So children are routinely vaccinated against Haemophilus influenza. So the vaccines have greatly reduced the number of serious hemophilus type B infections such as meningitis. So if two or more children in nursery or daycare center have hemophilus influenza type B infections within 60 days period, adults and children who were contact with them should be given antibiotic. So now let's proceed in the mycoplasmal pneumonia. So mycoplasmal pneumonia which do not have a cell wall. So meaning do not grow and under the condition of normally used to recover most bacterial pathogens. So it is a bacteria or it is a germ that can affect in different parts of your body or in our body. So it depends which body affected, either in our lungs, skin, your urinary tract, depends on which type of mycoplasma bacteria causing your infection. So if you're infected in mycoplasma pneumonia, you may get symptoms like sore throat, a cough, fever, fatigue, and headache.
Mycoplasma pneumoniae is a small bacterium which causes atypical pneumonia in young adults. Mycoplasma, as a genus, have a cell membrane that's packed with sterols, but they lack a proper rigid cell wall. Therefore, they don't take up dye under gram staining, so they cannot be visualized with light microscopy. Additionally, they're highly pleomorphic bacteria, meaning that they have no fixed shape and size, and they're also osmotically unstable in the external environment. So, to survive, mycoplasmas invade host cells and live intracellularly. Now, Mycoplasma pneumoniae is a facultative anaerobe, meaning that it can live without oxygen if it has to, but it grows better in an aerobic environment. So it prefers places like lungs or respiratory airways, where there's an unlimited flow of oxygen.
Sign up for a free trial today and watch the full video on osmosis.org.
So now let's proceed in the diagnosis. So diagnosis based on recovering with the pathogen might not be useful in treatment because as long as 3 or more weeks may required for the slow growing organism to develop. Treatment. So treatment with antibodies such as tetracycline is usually has tends to disappears of symptoms but does not eliminate the bacteria which the patient continue carry for several weeks. Meaning they have to carry this in several days or several weeks. So I have there some prevention of mycoplasmal pneumonia. So first, cover your mouth and nose with tissue when you cough or sneeze. Put your tissues in a wastebasket. If you don't have a tissue, cough or sneeze in your upper sleeve or elbow, not in your hands, not in our hands like this. So wash your hand often with soap and water at least 20 seconds. So if no soap are available, you can use a hand sanitizer or the alcohol. Now let's proceed in letter D. Legionellosis. So it is a bacterium. L. pneumonia was first identified in 1977 as the cause of an outbreak fever of pneumonia and convention center in USA in 1976. As you can see in the picture, this is the picture of the bacteria. No person-to-person transmitted seems to be involved. So death occurred through progressive pneumonia with respiratory failure and or shock on multi-organism failure. So the disease is characterized by a high fever, about 40 degrees Celsius, cough, and general symptoms of pneumonia. So usually ang Usually the symptoms of this high fever and cough. So I have the
Legionella pneumophila is a gram-negative bacillus, which means it's shaped like a rod and can be found in many water systems, such as hot water tanks, cooling towers, large air conditioning systems, or hot tubs. It's typically transmitted by inhaling infected aerosols, like contaminated water sprays, jets, or mists, and causes a disease called legionellosis with two distinct entities. The first one, Legionnaire's disease, got its name from a deadly outbreak of pneumonia in 1976 among people attending a convention of the American Legion. And the second one, Pontiac fever, got its name from Pontiac, Michigan, where the first case was recognized.
So now let's proceed in the diagnosis. So doctor typically use two preferred types of tests to see if the patient pneumonia is caused by Legionella. So first, the urine test or laboratory test that involves taking sample of sputum or a washing from the lung. So people with this disease have a serious type of pneumonia, the lung infections, which can be confirmed by the chest x-ray by the doctor. So treatment. So this disease required a treatment with antibiotics, and most causes of this illness can be treated successfully. So about 1 out of every 10 people who get sick in this disease will be die due to complications from their illness. So for those who get this disease during the stay of healthcare family, 1 of every four will die. So meaning 1 out of 4 will die with these diseases. So this also includes the Pontic fever. So a mild systematic disease with symptoms resembling influenza probably caused by Legionella infections include fever and usually cough. However, a negative test doesn't rule that someone has this. This is called a false negative. So the doctor must often diagnose Pontic fever when there are other known cause of Legionella infections that lab tests confirm. So they have a diagnosis. So doctor can use urine or blood test to see if someone has this fever. So treatment. Pontic fever goes away without requirement treatment. So meaning, without any treatment, you're going to heal with this fever. So now let's proceed in cytosis. So the term cytosis is derived from the disease of association with cytokine birds, such as the parakeets and other parrots. So usually came from the parrots, as you can see in the picture. So it is a form of pneumonia that usually causes fever, coughing, headache, and chills. So it is an infection transmitted from vertebrate animals to humans. So it was later found that the disease can be also contracted from many other birds such as chicken, ducks, and turkey. So pet store employees and people involved in raising turkey are the greatest risk of contracting this disease.
Psittacosis, also known as parrot fever, is a common illness caused by birds. It is caused by bacteria that infected birds release through their feces and through their mucus. It is transmitted to humans when they inhale the bacteria.
So now let's proceed in the diagnosis. So diagnosis is made by isolating the bacterium in embryonated eggs or by cell structure. So serological tests can be used to identify isolated organisms. So no vaccine are available. So but cleans are effective antibodies in treating humans and animals. So treatment. So your doctor will prescribe the a tetracycline antibiotic like doxycycline or treat cytocosis. Your doctor will prescribe a tetracycline antibiotic like doxycycline to treat uh, cytocosis. So these diseases are rare in children, but present in special challenges in its treatment. So usually, if the children discover this kind of disease, usually they will recover. So last, we have the avoiding. Pet info provide joy and companionship. Avoid contact with dropping, urine, mucus, blood, and other body fluids of your pet, especially if you know they are infected. So wash your hand carefully after being around of your pet, even you haven't touched him, especially when you are going to play with your dog. So always remember, wash your hand. Wear protective gear when handling pet habitats like pet cups and cages and pet food and water dishes. So clean your pet. It is very important. Clean your pet frequently to prevent the collection of dried feces to become airborne. Let's proceed in the chlamydial pneumonia. So outbreak of respiratory illness population of college students were found to be caused by chlamydial organism. So the disease apparently transmitted from person to person, probably by the respiratory routine. So common symptoms you may experience the fatigue, headache, low grade fever, throat soreness, uh, hoarseness in your voice, coughing, sneezing, and runny or stuffy nose. Medial pneumonia, it is one cause of community-acquired pneumonia or lung infection developed outside of healthcare setting. However, not everyone exposed to chlamydial pneumonia will develop pneumonia. So meaning not everyone makadevelop of chlamydial pneumonia. So to practice good hygiene, you should put your used tissues in waste basket, cough or sneeze, upper elbow in your mouth if you don't have a tissue like this one. Next, wash your hands often with soap, and of course it is very important to sanitize your hand that contains 60% alcohol if soap and water are not available. So now let's proceed in the Q fever. Organism is uncommon but may be found in cattle, sheep, goats, and other domestic mammals, including the cats and dogs. So, how is the Q fever spread? So, rarely, a Q fever has been spread through blood transfusions from the pregnant woman and her fetus or through sex. So now there are these are the symptoms. I'm sorry for the wrong spelling of my symptoms of Q fever. So they have fever, extreme fatigue, severe headache, diarrhea, cough, chest pain, and many more. So treatment. So acute Q fever is treated with antibiotic. Chronic Q fever is often treated with the combination of antibiotics and anti-inflammatory medication, but it can be hard to treat. Your provider will create a treatment plan based on your specific illness. So medication or treatments are used. There are your provider prescribed. There are the medication. Thank you so much for watching or listening. Bye. So now there are these are the symptoms I'm sorry for the wrong spelling of my symptoms. Fever, extreme fatigue, severe headache, diarrhea, cough, chest pain, and many more. So, treatment. So, acute Q fever is treated with antibiotic. Chronic Q fever is often treated with the combination of antibiotics and anti-inflammatory medication, but it can be hard to treat. Your provider will create a treatment plan based on your specific illness. So medication or treatments are used. Thank you so much for watching or listening. Bye.